Well, joining us now is Africa 54 health correspondent Linord Moudou on recovering from the Ebola blow. Linord.
Hello, Vincent. Well, the World Health Organization's Assistant Director General for Health Systems and Innovation, Marie-Paul Kieni, says donors have pledged $1.4 billion of an estimated $2.1 billion over the next 2 years to help Guinea, Liberia, and Sierra Leone rebuild their battered health services after the Ebola epidemic. She says full recovery in the three countries will not happen if the health systems are not strengthened. The re-emergence of Ebola in Liberia last week has, however, stoked fears that it may take longer than expected to defeat the epidemic. UN Secretary General Ban Ki-moon will host an international Ebola recovery conference in New York on Friday to raise additional funds for reconstruction. The WHO has been widely criticized for its response to the Ebola epidemic, which killed more than 11,000 people in Guinea, Liberia, and Sierra Leone. Now, in a report released today titled The Global Tobacco Epidemic 2015, the World Health Organization says not enough governments make full use of tobacco taxes to dissuade people from smoking. The United Nations Health Agency says that 1 person dies from tobacco-related disease every 6 seconds or so, equivalent to about 6 million people a year. That number is forecast to rise to more than 8 million people a year by 2030 unless strong measures are taken to control what the WHO calls a tobacco epidemic. WHO Director General Margaret Chan says in the report that raising taxes on tobacco products is one of the most effective and cost-effective ways to reduce consumption of products that kill while also generating substantial revenue, end quote. The WHO recommends that at least 75% of the price of a pack of cigarettes should be taxed. Joining us in the studio for more on the subject is Joshua Kyallo, Africa Program Director for the Campaign for Tobacco-Free Kids. Mr. Kyallo, it is so good to have you back on Africa 54.
Thank you for having me, Linord.
Now, we heard about this report, the new report by WHO. What is your reaction? Do you think that increasing taxes on cigarettes is the step on the right direction?
Absolutely not. The Campaign for Tobacco-Free Kids, we fully agree with WHO that it's a resounding call for governments around the world to implement the proven measures for preventing tobacco death, which is the leading cause of preventable death around the world. And the most effective way to do this among governments is to raise taxes. It has several advantages. It's a win-win. One, it raises revenue, it reduces consumption, it saves life, while it is very cost-effective to implement. So we do absolutely agree with WHO that the time to do it is now, and do it urgently.
So a step to the right direction, but when we talk about raising revenues, among other things, isn't it also good for these companies that produce cigarettes in terms of their revenue?
The governments, the tobacco industry will always argue that raising tobacco taxes will increase illicit trade, among other arguments. That's always a fallacy. The truth is, if you look at a country like Brazil, they have one of the world leading producers of tobacco leaf. They have increased taxes over the years, and between 1989 and 2010, Brazil reduced tobacco consumption by almost 49% through effective tobacco taxation. So again, we come back to the key point that the most proven method of reducing tobacco consumption, saving life, is tobacco taxes. And yet, among the measures that the WHO recommends, it's a list that has been implemented. And so the report is saying, let's increase taxes by at least by 75% of the retail price. It's a win-win for the government. We are urging governments to take action now.
Now, there are some people that argue that, listen, smoking a cigarette is not like drinking alcohol where you can become impaired, your judgment can become impaired. You know, this is one's responsibility. It's their health that is being impacted. It's their money that they're spending. So why is there such a big emphasis on the need to reduce smoking?
Because the science is clear, the evidence is overwhelming that, as you said yourself at the beginning, in the 20th century, tobacco killed 100 million people. By the 21st century, it will kill 1 billion people. 1 billion people. So what we are saying to the governments is there are measures that have been proven. One, warn people about the consequences of tobacco use, prevent people from exposure to tobacco use. 100% smoke-free policy should be in place. Put graphic health warnings of at least 60-65% above on a cigarette pack so that people know the consequences of tobacco use. And again, as the WHO report says, increase taxes. The governments have a responsibility. They signed the Framework Convention on Tobacco Control. They ratified it. It's an obligation. And it's a proven method of saving lives. And we are urging governments to take action now.
Now, the campaign for tobacco-free kids, why is it important to put an emphasis on kids, on youth?
Because I think for us, it's about saving generations. Of course, tobacco use affects all generations. But I think we have an obligation as a society, as governments, to put in place measures that will protect everybody in the society, beginning with children. Tobacco kills, causes disability and diseases. It has deadly effects on those that primarily smoke. It also has effects through a secondary exposure to smoking to innocent children, to family members. So at the campaign for tobacco-free kids, we are saying the time to act is now, especially in Africa, which we cover, and where the rates are still low compared to the rest of the world.
And before we wrap up, what you mentioned Africa, what are you doing in Africa specifically?
We are working with governments across Africa to put in place laws and measures that are compliant with the Framework Convention on Tobacco Control, to pass laws to prevent tobacco death, to implement those laws to protect populations, and to take the measures that are within the Framework Convention on Tobacco Control, as I said, on around 100% smoke-free policies, graphic health warnings, ban on tobacco advertising and promotion, and also tackling the tobacco industry head-on and stopping them from interfering in the policy-making process of the government. But again, my key message is back to the report from World Health Organization, is now is a time for governments in Africa to increase taxes, raise revenue, drive down consumption, save life, protect health. It's a win-win measure for the African governments, and the time for African governments to act is now.
Thank you so much, Joshua Kyallo, for joining us today.
Thank you, Linord.
And that was Joshua Kyallo. He is Africa Program Director for the Campaign for Tobacco-Free Kids. And that's our Africa Health Report for today. Back to you, Vincent.
Well, and thank you very much for joining us today, Linord. Be sure to watch for Linord Moudou every Tuesday and Thursday for the latest health news in Africa, right here on Africa 54.